Assalamualaikum doctors. In this video I am discussing a history about Fanconi anemia. So Fanconi anemia history how can come? The chief complaints maybe the child come with short statures, or maybe the child is pale, or maybe the child has any hand abnormality or pale because we know Fanconi anemia is associated with leukemia, pale pancytopenia, so like that. So first, present history analyzing the chief complaints, onset, course and durations, anything make it better and anything make it worse. Then hookup. Hookup means hemodynamically stable or not. How can we ask? Anytime he fainted, the onset of bleeding, color of the bleeding, any other size of the bleeding, amount of bleeding, these are we ask. Preceded by any illness like fever, any fever present or not, that is. Then any other concern, any unusual features, unusual features, hand abnormality, especially the thumb abnormality. Remember, they have thumb abnormality presents on Fanconi anemia. Okay. So these are any chronic disease the child is suffering or not. Then general as usual FWASL, fever, weight, activity, sleep. These are we are asking. Then we go for the systemic review, MSK, skin spots like capillate spots present in Fanconi, lump, neck swellings and other lumps in the body, bone pain, deformity, fracture, hair, nail and teeth. Then CNS, increased intracranial pressure, abnormal any movement, abnormal behavior, abnormal gait, face asymmetry, vision concern, deviation of the eye because squint is present. Remember, so eye alignment. Speech, any concern regarding hearing. Chest is recurrent bug, chest pain and cough. Endocrine, thyroid, addition and blood sugar because diabetes mellitus is associated with Fanconi, so blood sugar is very important. We go the hematology, pallor, any bruises, recurrent any bugs, any history of blood transfusions present or not, we asked. Then past history as usual 5T IOA, any trauma, traveling, blood transfusions, any surgery, previous any admissions, examinations, any team following. So drugs, radiation, chemical, these are. Parental history difficult to feed, his pulse at birth, any concern regarding private area boys for hypospadias. So private area boys, any issue present or not, pulse rate at birth, these are we are asking. Then we go puberty in girls. Very important to ask if anyone talk to you about safe sex. Okay. Then we go vaccination, any extra shots, especially for HPV, human papilloma virus, because high risk of squamous cell carcinoma and vaginal carcinoma occur. So we need to know about HPV vaccine. And family and financial, social and psychological, as usual we are asking. What is the DDO of pancytopenia and Fanconi anemia? Aplastic anemia, radiation, chemical, viral infection like parvovirus. Remember. So aplastic anemia, radiation, chemical, viral infection like parvovirus. DDO of bleeding, local is any trauma, tumor, polyp, foreign body, and systemic is hypertension, vitamin K deficiency, that is Higashi disease and Noonan, liver disease, leukemia, lymphoma, myeloproliferative disease, neuroblastoma, decreased platelet count and functions, coagulation defect, vascular von VWD, von Willebrand disease, aplastic anemia. So these are research. So giving a short review about Fanconi anemia. Fanconi anemia, there is defect in DNA repair. It is an autosomal recessive condition, remember. And they have increased risk of AML, acute myeloblastic leukemia. It is a solid tumor and aplastic anemia. They have macrocytic anemia, elevated fetal hemoglobin. So remember, they have anemia, pallor, pale present. They have absent or hypoplastic thumb, especially they have thumb abnormality. Absent, in my picture that is absent. Sometimes it can be short. They are very short stature, lossed ears and deafness present. So hearing, strabismus, eye condition we have to ask. Skin hypopigmentation, renal abnormalities, and the treatment is bone marrow transplant. Remember, bone marrow transplant is the treatment. Thank you.